So good morning, good afternoon, good evening, everybody, depending on where you're joining us from today. We have a webinar for you today on a holistic view on food security, alleviation, and we have Millie Carmichael, who's a health improvement officer in Bath and North East Somerset with us today. I'll introduce Millie in just a couple of seconds and talk to you a little bit more about her work before she shares it in more detail with you. But just for 2 seconds, and for those of you that don't know very much about GoDan and what we do, I'll just introduce what we do very briefly. So Global Open Data for Agriculture and Nutrition supports the proactive sharing of open data to deal with the urgent challenges of ensuring world food security. We have at the heart of GoDan a network of over 1,200 partners from government, private sector and public sector organisations and international organisations as well. We focus on building high-level support among governments, policymakers, international organisations and the private sector, and we look at promoting collaboration to harness the growing amounts of data and information that are generated by the increasing amounts of new technologies to solve long-standing nutrition and food security issues. If you would like to find out more about what we do, you can have a look at our website, www.godan.info/about GoDan, or you're perfectly welcome to contact either myself, Catherine Bailey, or our Chief Scientist, Sushith Anand, who is also responsible for our working groups programme. This webinar that we're doing today is in the context of our working group on food poverty, where we're looking in general on food poverty, starting with developed economies and looking to see what lessons we can learn from the work, the very important work that's going on. So Millie, who is here with us today, works as a health and improvement officer in Bath and North East Somerset in the southwest of England in the United Kingdom. She has a background in nursing, health advising, training facilitation and horticulture, having studied and practiced permaculture for over 10 years. And through her various roles, she's gained a unique perspective on questions of health, nutrition and food security. Her and her team have been doing some very progressive, holistic work around dealing with both the symptoms and the causes of food security in the region. And if you're ready, Millie, I would be absolutely delighted to hand over the screen to you.
Oh, bless you. Thank you very much, Catherine. I will share my screen with you now, hopefully. Let's see where we go. Okay, are we all right there?
Yes,
excellent.
perfect.
Okay, thank you. So yes, hi, my name is Millie and I'm working at Bath and North East Somerset Council, as Catherine said. My contract actually has recently been renewed and we've changed the language around the role. So I'm actually no longer a health improvement officer around food poverty. It is now around food security. That was one of the things that was important to us in the work around the language that we use around these issues. So I'll just find where I can move my slides on. Bear with me a second. Okay, so in this presentation, I'm going to break it up into 3 shorter chunks and of about sort of 10 minutes each, with some time afterwards in between the sessions to ask questions if you'd like to, and then hopefully also some time at the end of the whole presentation. So the things that I wanted to think about today were these key points really. First of all, that cheap food can only be produced through impoverishment of people through the supply chain. That's quite a bold statement, but I hope I will be able to expand on that and explain what I mean by that. The second point is that cheap food is a major contributor to the climate and biodiversity crises that we're facing. And thirdly, that overproduction and waste that's inherent in our food system is increasingly being solved through redistribution to the poor. So I'm putting all of these things in kind of inverted commas for a reason. And the cost of that overproduction and waste is largely being met by the third sector. So this presentation is really to share some thoughts on how we can raise awareness of those links and move towards a more holistic approach. So one of the ways that we can illustrate these issues around the current system is with one element, and this is the Healthy Start voucher. So these vouchers are available for women on certain means tested benefits from 10 weeks of pregnancy. This is in the UK, and for children up to the age of 4. And they can be used to purchase simple, fresh, frozen, tinned fruit, veg and pulses, cow's milk products, plain cow's milk products, and baby formula. So until recently, those vouchers were worth £3.10p a week, and that value has now recently increased to £4.25 after the big push in the UK from Marcus Rashford and his task force around children's food poverty. But for the purposes of this, I'm going to look at the value of the voucher as it was at £3.10p. So what I did was I was looking at our supermarkets and thinking about how much can you buy for that amount of money within those parameters for the Healthy Start vouchers. And so this slide shows the maximum quantity of frozen veg and a small quantity of fresh fruit that can be purchased from Tesco's, so one of our main supermarkets, with a weekly Healthy Start voucher. So this is kind of a best exchange example, if you like. So other low price supermarkets like Aldi and Lidl, they're likely to offer something very similar. Iceland, actually, so a number of our retailers are offering supplementary offers to these vouchers at the moment. So Iceland, for instance, offers an additional £1 bag of frozen veg. The Sainsbury's are offering a £2 supplementary voucher. So our retailers are boosting the value of these vouchers. However, that maximum value is only possible if someone lives within walking or cycling distance of one of these low cost supermarkets. So otherwise we have to build in transport costs to be able to access these offers. So local convenience stores will not have this range of foods available, or they won't be at that low cost. So the exchange value of a Healthy Start voucher is not equitable, and I think that's something that we really need to kind of bear in mind. So also, of course, nutritionally, foods that are frozen within hours of harvest can have higher vitamin content than fresh food that has that may be several days old. But to take advantage of that, you also have to have access to a freezer to be able to keep those frozen foods fresh. So while Healthy Start is a really valuable contribution to the efforts that we make around food insecurity and food poverty, it's not equitable in the way that people can actually access its value. Now, the other issue that really struck me when I was exploring this was look at the quantity of food for a relatively small amount of money, and to think about how can all of this food be grown, harvested, processed, frozen, packaged, stored, transported and sold for just £3.18p, while still making a profit for somebody in that process. So I think this can only happen by using poorly paid agricultural workers, industrial style and scale of production, reliance on chemical inputs, and outsourcing all the detriment that creates to animal welfare, environmental pollution, and human impoverishment. And the bill for that is generally picked up elsewhere, and it's made invisible to the price of food in the shops. So people who work in the farming, food production, processing, transport and service industries are among the lowest paid, and they're in the most insecure sectors of work. So in producer countries, there are often trade agreements that limit export to raw ingredients only. So things like you can export cacao, but you can't export the value-added processed version of that, i.e. your own chocolate bars. So that further impoverishes suppliers in the majority world. So this is my first point, really. Cheap food can only be produced through a degree of impoverishment of people throughout the food chain, and it is a huge problem for us to address. But my second point really is that this system wastes a lot of food. Estimates vary, but around a third of all the food that is grown for people is not consumed by people. And the reasons are myriad, and they happen at every stage of the process. So while this graphic suggests that all the effort and resource has been for nothing, as it says at the bottom there, that isn't actually true, because at every point of the process, financial exchanges were made, and each of them contributed to GDP. So our core food ingredients are commodified and sold on the stock markets in the same way as any other commodity. So when the price of staples crashes or rises, people really suffer. This commodification doesn't serve the purpose of feeding people nutritious food that cares for the environment it was grown or raised in. It doesn't matter much to the system whether the food is eaten or not. It matters to the system if product is sold and profit is made. Now, that may sound harsh, but if that level of waste really impacted the bottom line, it would have been eradicated a long time ago. So I'm going to propose that we change the way that we talk about this. And I've found a really lovely quote that comes from a food strategy in Oregon in America. And it suggests that we change the way we talk about food waste, that we stop calling it food waste because food waste is a noun, and we start talking about wasted food as a verb. So something that then is an action. And if we're doing it, then we can stop doing it. And so, yeah, so I'm going to suggest that we all think about changing the way that we talk about this, stop talking about food waste and start talking about wasted food, and see it really in that light. The most common narrative around food waste, whether it's in the literature, so papers like this, where we see that prevention should focus on households, or in infographics for national campaigns. Okay, so again, biggest generators of food waste, households and restaurants. Here we see overproduction in this sense is about restaurants overproducing food. But that is largely because we have this linear system of production and households and restaurants are the end users. So the level of waste at that point of consumption is a reflection of the amount of overproduction that got that far along the line. So if we think about sort of rationing during wartime, here in the UK, and for many years afterwards, there was virtually no household or restaurant waste because there wasn't an overabundance in the system to start with. Waste that manifests at that level has to come from somewhere, and it is generated upstream. So when we're confident that the shelves will always be full, the shops are going to be open 24 hours a day, when buy one, get one free offers at the end of every checkout to shift more stock, restaurants offering all you can eat buffets, we don't value food in the same way. We take it for granted because we're confident that there will always be more and there'll be plenty of it. So as much as we're told about how expensive food is, we actually spend a smaller proportion of our incomes on food now than we ever have done. And the elephant in the room here really is overproduction, which is consciously and deliberately designed into the system to ensure a continual and overabundant supply of perfect goods. Okay. So this is my last slide for this little section, and then we can have maybe a couple of questions if people have some thoughts. So this is a really quick Google search really for what drives overproduction in the UK. Will basically put that responsibility squarely with retailers and supermarkets and farmers, as if that's actually what they all want. But they're servicing it, but they're not really driving it. What drives it is an economic model that's much bigger than any of these individual players. It's one that puts profit maximization above and beyond any other consideration, and a belief that free markets will balance themselves and solve any inequity without the need for government or civic intervention. So we've got this suggestion of a food recovery hierarchy, and the suggested top priority there is source reduction as the first line for managing all this wasted food. But in practice, that is actually the least well implemented stage in this process. Instead, what we're doing is the second line of action, feed hungry people, is being given more attention. And then we've got this whole diverse sort of ecosystem of routes of redistribution that are now in place, and they're becoming increasingly embedded as we seek to solve one problem, food insecurity or food poverty, with another of wasted food. So if you try to solve a problem with the problem, you essentially embed both of them forever, solving each other. So in this country, since what was colloquially termed mad cow disease, we don't feed food scraps to farmed animals anymore. Composting comes a very poor second actually to anaerobic digestion as a means of managing inedible wasted food. So we've got this growing industry is building around industrial uses for waste food, and that's troublesome because reducing or eradicating the food source will now increasingly actually impact on existing jobs and livelihoods and resources that are created from that waste stream. So it's sort of like the more we build, we ignore that first line, but we build infrastructure around everything below it, it makes it much less likely that we're going to actually tackle the root problem in the first place. So that's the first little section of my presentation. So I'm going to stop sharing and just see if people have any questions that they want to ask at this point.
Thank you so much, Millie. That was really very enlightening and very thought-provoking. And we've had quite a few comments coming through from the audience saying how much they're enjoying the presentation and how informative it is, but not so much in the way of questions yet. Okay. So if everybody's okay, then would you be okay to just carry on now? Fantastic. Thank you very much. Thing is you're covering all bases, so there's not much to ask questions about yet. I'm sure they'll come.
Okay, no worries. So if we think about what's happening, well, let's look at a bit closer at that ecosystem, if you like. These are some of the elements of this, what I call an ecosystem of food redistribution. So I could add others. We could fill this slide really. I could add sort of UK Harvest or Banquet, the Gleaning Network. There are apps like Neighbourly and so on, and I'm sure in other countries there are different things in place, but they're largely similar. So I'm not knocking any of these. They are doing absolutely sterling work, and there are millions of people now who have been helped significantly by these organisations. And it's pragmatic that we use this resource. This surplus food is there, so it's pragmatic that we use it. And we use it to make positive change in the lives of people in need. But the responsibility and costs, though, are largely held in the third sector or in voluntary mutual aid responses. So the food industry does not pay the full cost for the responsible management of its waste. It's cheaper for them to discard to landfill, actually, because they're not required to bear the costs of what they're producing. And we are also persuaded that our food costs would rise unacceptably if this responsibility were taken by the organisations who create the problem. So the whole narrative around this is really quite strange, and it hides this really big issue of waste and overproduction in the system. So the other thing is that a lot of the food products that are ripe for this redistribution are high fat, sugar, salt foods, and they're processed foods. And so fresh fruit and veg and bakery products that have a much shorter shelf life, they need different infrastructure to redistribute them efficiently. And that needs to be agile and pretty complex to make best use of that kind of small window of opportunity while that food is still relatively fresh and edible. So and also to be able to redistribute that in a spirit of equity and fairness, so it reaches the people who really need it most. It's a really big ask, and it's largely being done by a poorly funded third sector running on voluntary effort, which again, when we really think about that, it's not okay. And so, yeah, I just want to kind of stimulate some thought about this relationship between food surplus and its redistribution and who it's helping and who is actually doing the legwork around that piece of work. Now, I'm going to go off tack a little bit here, and I added this in because it was something that I've been working on recently. I'm doing a master's in public health, and we were asked to look at leadership in public health around a particular public health issue, and we were looking at antimicrobial resistance. So this is a wider issue that is actually, but it's intimately linked to our industrial and wasteful food system, and it's often isn't brought into the conversation when we're thinking about food, but it's really serious because it actually poses a profound risk to people's health and well-being, and again, it impacts poorer people and poorer countries disproportionately. So the idea here is that we were looking at what were the drivers of antimicrobial resistance, and one of them is the overuse or inappropriate use in farmed animals. So you have routine subtherapeutic doses. It's not so much in the UK now, but certainly in other parts of the world. And you know, we've got a global trade in these goods. So being used as a growth promoter or as prophylactic treatment, and that's a powerful driver of antimicrobial resistance. But in sort of health, public health form, we would look for the causes and then the causes of the causes, and then think about how we can address those things. So when we got, so this piece of work really was looking at the causes and then the causes of the causes, how COVID had affected this issue, and then maybe what we need to do in a sort of a leadership way. I'm not going to go through every box that's on this slide. People can have access to these slides afterwards if you would like to see them in more detail. But the idea is here that what I hope becomes evident as we move through this flowchart is that how the approaches we take to tackle one problem, if we look at it deeply enough and go back far enough, upstream, can actually have a positive impact on other areas of public health, all of which, again, disproportionately show themselves in patterns of health inequality. So what we can do to address this aspect of antimicrobial resistance, if we tackle if we tackle it at the right level, if you like, can actually have an impact on coronary heart disease and obesity and hypertension and poverty eradication and so many other things further down the line. We just wanted, it's again an illustration of everything is connected, and we need to keep looking back upstream to the root causes of these issues. Okay. So this is, again, a bit of a bold statement that we have an impoverished food system. It isn't broken, it's actually consciously created in this way, and it meets the needs of some people, and it meets those needs really, really well, but it doesn't meet the needs of everyone. So I just want to be curious really about how can we do better, and how can we make connections between work around food insecurity and work around sustainable food and the broader issues of our food systems. So some of those connections are being made, increasingly they are being made, but they're still, I think, largely being addressed in parallel, but not so much together. And there are tensions between addressing food insecurity and addressing sustainable food, and I think that we need to examine those really in much closer detail. So one of the ways that we can do this was a screenshot from a slide that was presented by Professor Tim Lang. This was back in March, and he was presenting at a conference, and the session was titled "What's Breaking Through as Food Systems Are Breaking Down?" And what we can see from this, and basically what he's saying, is that we need to look at this from not just the health, social values and food quality issues, but across economy and governance and environment. We have to look at the whole picture, and in a sense it's incomplete if we aren't also looking at the economy and governance and environmental issues. I think in public health we're much more familiar with looking at health and social values and quality, but actually we need to be looking at all of those across the piece, and working much more closely with people who are working in those areas. Another slide that came from his presentation when this was an analysis of the alternative food movement, because this was the audience that he was speaking to actually at that presentation. But he was saying that there are some arguments that are being won, but they're not yet achieving significant change. I think actually that a tipping point is closer than we might imagine. So, for instance, in the early part of the year, back in January, there was an Oxford Real Farming Conference. The Real Farming Conference has been running for some years now, and it's got quite big, and it's online. But this is where those people who are changing the food system gather and share their ideas about how to change the world, really. And I'd advise any of you to have a look at the recordings of some of those sessions from the Oxford Real Farming Conference this year, because they do tell a really strong story about what's happening, about changing our food system globally. But he was also saying that a wedge has not yet been driven into normality. And I think that was a really interesting turn of phrase, and that more coordination is needed. Now, when he talks about food power, in the UK, we have an organisation called Sustain, who have a scheme called Food Power, which is about tackling food insecurity. That's not the food power he's talking about here. He's talking about corporate food power, and that is consolidating, that it's getting fewer and fewer people dominating more and more of that system. So if we're serious about wanting to eradicate poverty, we need to look at the contribution that this monopolised food system plays in people's impoverishment, and the impact that it's having on the huge and urgent global challenges that we face. So the brunt of which, again, is largely being taken by the poor and the vulnerable. It's like they're caught at every turn. So that's the second little bit of my presentation. The third section is kind of coming back to looking at a more individual, household, local level, and a little bit more about what we're doing in our work in Baines. So I will stop again for a moment and see if there are any questions that are coming up for people.
Okay, there's been quite a few questions, actually, quite a few very interesting questions in this section of
I
your
can't promise I can answer
presentation.
them all, but I'll give it a go.
Fabulous. Siobhan is saying, this is very interesting. Absolutely. Do you have any other thoughts on whether the true cost accounting model can improve the efficiency of the food system and decrease food waste, or perhaps any criticisms or alternatives to the true cost accounting model?
I think I will just have to put my hand up and say I don't know enough about the true cost accounting system to be able to speak very eloquently on that. I do think that we just need to look at the true cost of food really differently, and understand it and acknowledge it. I don't think I can give any detail about exactly how to do that, but it's something that I will go away and have a good think about, because we need to look at it locally, but fundamentally food is a global system, and I think it's very difficult to tackle these things only at a local level. However, if lots of people are doing things locally, then it starts to join up and coalesce. So for instance, I know there's amazing work going on in Bristol, who is kind of one of our neighbouring authorities. I know that there's great stuff going on in Wales, which is just over the border. So, you know, the Southwest region, we have a Southwest food hub now, which I'm going to talk about a little bit in the last section. So I think we can start locally and join up with our neighbours and kind of become formidable. But fundamentally, it's a global issue that needs to be addressed at a global level.
Okay, thank you. Fiona is asking, are you working with, well, you addressed sort of this hierarchy of the food chain, and are you working with any local authority or county scale stakeholders to address this hierarchy? Would any local, regional, national scale, do you think that local, regional or national scale responses work best?
I guess I answered that a little bit in the last question. I think that we need to do what we can at whatever level we have an influence, and all of those levels need to be kind of have skin in the game, if you like. Fundamentally, there is some stuff that needs to change at policy level, I guess, that has to happen at government level. But from the point of view of my own role, my job is concerned with household food insecurity, and it's a part-time job. And I'm the only one in public health who's doing it. So we are working with colleagues who are looking at some of those broader issues, and we are starting to bring in more resource to address the bigger issues around the food system and look at that through the lens of the climate crisis. So that's coming, and we're having those conversations, but we're not quite there yet. But yeah, I think at whatever level you can influence this, we all have a responsibility to do what we can at whatever level we're working. I don't know if that answered your question, but
thank you. Well, I think it did, but
okay.
maybe Fiona can come back to us if not. So Michelle is asking about the terminology of food waste. Should perhaps waste be removed completely and surplus substituted in its place, just because waste perhaps sounds like food is therefore inedible?
Yeah. Yes, so I think depending on where we're talking about it in the system, we do need to be conscious of the language that we use. So I'll try and keep my threads. Okay, so two things around this. One, you mentioned in my biog at the beginning that part of my background is in permaculture. I've studied it and tried to practice it as much as I can. So one of the key design principles of permaculture is produce no waste. It's not produce less waste. It's, or, be careful about what you do with it, or recycle your waste. It's don't produce any, because permaculture comes out of an observation of how the rest of life does things, and no other creatures on the planet waste any resource. So we have a really strange notion that waste is even a thing. So yes, I do think we need to change the language around it. And the other thing, one of the projects that I've been involved with in Baines is crop drop, which is the redistribution of allotment surplus. So this time of year, and it's coming up to this time of year when there's a glut of runner beans and courgettes and all that kind of thing. The project started last year, and it was offering that food, that surplus, to community projects who were supporting people. And we were really clear in the language around that we did not mention waste and composting in the promotion of that. This was absolutely about a generous sharing of abundance. That was how we'd couched this project. And I felt very strongly that we were not to put that message out and then say, and by the way, you're saving this food from compost. It's like, no, that's nobody wants to eat food that's just about to go in a compost bin. So yes, language is really important, and I would like to live in a world where we didn't have waste and we didn't talk about it in that way. Overproduction would be helpful, and again, going back to that idea of using verbs, not nouns, is moving in the right direction.
Fabulous, thank you. That makes absolute sense. Michelle says that she agrees, so thank you for that.
Thank you, Michelle.
And Fiona is saying yes, thank you in Welsh, and talking about a Welsh conference, a farming conference. If you could, Fiona, share that with the participants as well as the panelists, then that would be fantastic, because that looks like it could be quite interesting, and there'll probably be a little bit of interest there among the participants.
I've seen
Sushita's asking, what are your thoughts? This is a very good question. What are your thoughts on the Glasgow Food and Climate Declaration? I'm not sure if you've come across that yet.
Yes, I have. Yeah. We've that's been circulated, and we're looking at how we can be prepared enough to sign up to that in Baines. And yes, there's real willingness to do that. We need a little bit more structure in place and resource to be able to take that forward, but in principle, absolutely. And I think that there's something really powerful about that. Food is phenomenally powerful. It meets, again, I'll talk about this a little bit in the last section, but in terms of all of the ways that it meets so many fundamental needs for us, it's not just about calories and nutrients, and how many people are involved in the food system and how much land is involved in the food system, that if we get food right, then pretty much everything else falls into place, to be perfectly honest. And it's that important. It's connected to everything else that we are concerned about at the moment, and is a huge driver of at the moment is a huge driver of greenhouse gases and climate change and so forth, and soil and water and air quality and everything else. So yes, I think everybody sign up for it. And if you don't know about it, then I think there is a link probably in the chat, is there, that's been added now. So
Yeah, absolutely.
Yeah.
So she's put a link there in the chat,
Mm.
and they're looking for local councils to get involved, to sign up and pledge their support. So if you are involved with the local council or local business, because you can join as a partner as well,
Mm.
then do take a look at that. And we did actually, on one of the previous webinars in this series, we had Sophie Quist from Nourish Scotland, who is the organisation who set up the climate declaration to begin with. So if Sushith, if you're hearing this, if you could put a link to that presentation in the chat, and it will allow our participants to find out a bit more about that as well. So Millie, if you're ready, then we'll perhaps move on to the next bit of your presentation. Thank you very much.
Thank you. Thank you. Okay, so are we there, I think? Okay, so this next bit is really coming back to, bear with me, is coming back now to thinking about an individual and household level action, and a little bit more about what we're doing in Baines. So what most people want from their food is actually quite a big ask. Ideally, it will be sustainable and affordable and accessible and nourishing and acceptable to us, so culturally, socially acceptable to us. And it does, like I was just really talking about, it fulfills a lot of needs. It's not just about calories and nutrients and whether we're hungry or not. Food meets almost all of our fundamental human needs, really. But when you add poverty to that picture, it colours that picture. It impacts on every single aspect of food being good enough for people. And the field is narrowed, so you end up with a situation where actually affordability and accessibility become the only priorities. And those other aspects now become kind of nice to have, or even unobtainable. So people are forced to make compromises. And then in the process, unwillingly and with deep irony, or I don't know if that's the right word, but they then are contributing to further impoverishment of the system and its drive to pump out cheap food. So when you are poor yourself, in an effort to find food that is affordable to you, you may then be inadvertently contributing to this impoverishment of the system. And there's a cruelty in that, which I think is really disturbing, actually. It's quite difficult. So it's important that we see our whole food system through the eyes of people who have very limited incomes, and that we make good enough available to everybody. So when there's this simple imbalance of more money going out of a household system than is going in, and what we fundamentally want to do is to address that issue in the work that we're doing in Baines around household food insecurity. And we also have to keep our sights on this goal while we're addressing immediate and short-term food needs. Some people are in food crisis in the short, medium and even longer term, but fundamentally it's coming down to this balance, and how can we help people to address that. So one way that we can move in that direction, and one of the things that we're working on now, is to include food security in all aspects, or all assessments of health and social care need, for instance, so that it's core to, because it's so central to all of those aspects of our health and well-being. It's crucial to our physical well-being, around prevention and recovery from illness or injury. It profoundly affects our mood, our capacity to cope with stress. It impacts on school attention, attendance and attainment. There's so much that food and nutrition is important to. So we're working towards really bringing it in as part of the core to assessment. So in a holistic food security review might look a little bit like this. So really asking people what gets in the way of you accessing good enough food. And for each person or each household, that picture is going to look different, but we need to understand what it is that's getting in the way, so that we can help people to address those issues. One size doesn't fit all when we're trying to resolve these problems with people. But then equally, to look at what does help me, what resources do I have, what do I know, what can I do, what family, personal resource do I have around me to help me, what can I build on, what already exists. And then looking at what's easily accessible to me. So going back to the beginning of the presentation when I was talking about Healthy Start vouchers, that it's not equitable. what you can get for those. It depends where you live and how far you have to travel to your shops and so forth. But what's easily accessible to people? What can we see? And then also a review of people's household budget. So how can we help people to reduce their outgoings without compromising their quality of life? But things like, how can we help people to be debt free? How can we help people to start a habit of savings if they don't already? Things like buying co-ops and community supermarkets and this kind of thing. And then how can we help people to increase their income in a number of ways? And fundamentally, we want that to be around secure contracts and employment, and not really relying on welfare to fill all of those gaps. So we're doing work in Baines now with our procurement team, and the teams are looking at real living wage and so forth. So we're really broadening out the base of the work to address the food insecurity. And then the other thing that I think is being looked at in a number of different areas, and it's certainly something that we want to take forward in Baines, is this notion about, could food in schools be a catalyst for creating not just sustainable food, but regenerative food right across our region? And when I first gave this presentation back in March, and since then I've learnt about Southwest Food Hub, who are in fact doing stepping into doing quite a lot of the things that I was imagining. So I'm really pleased to see that that's coming forward. So I'll illustrate this with a diagram, and this is sort of build up. This is kind of looking at some of the ways that we could build on what already exists in universal, means tested and targeted services. So this is for families with children. So I fully understand that there are different issues for families without children and for older people around food insecurity, but this is sort of a snapshot, if you like, of what we might be able to do better for this group of people who are hardest hit. So when we look at universal services, at the moment we have a free school fruit and veg scheme for a small number of children in primary school. So what if we extended that? What if free school fruit and veg, one portion a day, was free to all pupils right across the school age? What if we had all primary school years having universal free school meals, and not just the younger ones? And this is happening. Some local authorities are making this happen. And then, of course, underpinning that with free prescriptions and dental care. We often, again, don't ally these things together and promote them all together. But this is what an extended universal offer could look like. We've also got means tested free school meals, and we've got Healthy Start vouchers, which I mentioned earlier. So I'm just going to talk in a moment about how we could improve on these things that already exist. And then we've got holiday food projects and schemes as well. So just sort of taking us through this. So what if universal free school meals existed for all children at primary, at least, and that maybe that was government funded, but was supplemented by a pay-as-you-feel contribution from families? I'm quite keen on this idea of pay-as-you-feel and sliding scales, and trusting that people can offer or pay what they can for things. It's a leap of faith to trust people, but increasingly we see evidence that it does actually work. But if they were also locally procured, and so local procurement for school caterers. So as I say, since I first put these slides together, I found out about the Southwest Food Hub, and this is exactly what they're doing for the whole of the Southwest region, is looking at local procurement with these kinds of parameters for all publicly funded food, essentially food in the public sector, which is incredibly exciting to see. And the model that they're creating could well be something that rolls out nationally. So that's really exciting and very encouraging. So again, free school fruit and veg, if it's locally procured, if it was organic, seasonal, and required a connection to a whole school approach to food. And I saw a fantastic presentation yesterday by primary school in Southwark, I think in London, where this is exactly what they're doing, and it's made a phenomenal difference. just embedding food in the whole school day, and making sure that the food that children are eating is organic and seasonal, and it's magical, I think, in terms of the richness and the depth that can offer to children's experience in school. For other ways that we can improve this offer, again, free prescriptions and dental care, these are important things that underpin our health and well-being, and we could be better at linking them to these various food offers. Our Healthy Start vouchers, at the moment, there's quite a cumbersome process of applying for them, yet our Department for Work and Pensions know all the people who are eligible. So another thing that's being lobbied for is automatic enrolment for Healthy Start vouchers, and broadening out the base, so going beyond the usual big 6 supermarkets, and actually having markets and wholesalers and our community pantries being able to accept these vouchers, and broaden out the base, that people can actually exchange them. Again, there's push and there's lobbying to make free school meals an automatic adjunct to people who are in receipt of universal credit. At the moment, that doesn't happen, and there are many young people who are living in families that are on the edge of that means tested criteria, but they don't quite qualify, and they're struggling around food, but they're not even being able to access free school meals. So that's problematic, but there's lobbying around those things happening. And then again, having nationally funded provision covering all the school holiday periods going forward. So again, a lot of this is changing. This picture is changing and it is shifting, and we're moving towards this in a number of ways. And I think the important thing is that we just do things in a joined up way, and we see this whole picture. We look at this picture through the eyes of families who are having to navigate this. It's actually quite complex. So helping people to navigate this process is really crucial, and make it as simple and straightforward as possible. And for those transition periods to be smooth also. This is just the last couple of slides really to consider our mindset in all this. And I'm sure many of you will be familiar with this picture. So in the first image, we're treating people equally, but yet that doesn't kind of get everyone looking over the fence. With equity, then we are treating people differently to a degree, but it's giving everyone an equal opportunity. But actually what we need to do is something closer to the third picture, which is justice and real fairness, which is actually taking away the barriers and not just helping people to get over them, but actually removing them altogether. And my final slide is, I believe, is going to be, this is possibly my favourite quote, and is my touchstone for all of this work, really. That it is no measure of health to be well adjusted to a profoundly sick society. So I hope that we don't adjust ourselves to a food system that overproduces processed and unhealthy foods while wasting a third of its output. I hope that we'll find ways to creatively work together to change that system for one that's actually fit for purpose and for future generations and for other than human life. So that's my last slide. I'll stop sharing now. Okay.
Wonderful. Thank you very much, Millie. That was a very comprehensive view of what's going on. And I hope that people, if you do have questions, then do put them in the chat function. Although you have answered many of the questions as you've been going on. There was one that did stand out to me, though. And while the help available in the UK, I mean, arguably it doesn't go far enough, especially since we're a fairly wealthy economy. What do you think are the main barriers to people being able to access these supports in your experience?
Mainly, so in things that are related to welfare support, so free school meals and Healthy Start, for instance, the income limit is incredibly low. It's still really, I can't give you quotes, but you can look these things up online basically, but you have to be really impoverished to be able to access those things, and there are many thousands of people who are on the edge of that but aren't quite eligible, and I think those are people who fall through the net. I do think that we're better at recognising these issues for households with children, because there are so many points of contact for children with services, so school, for instance, but also healthcare and so forth. So I think we're better at that. I think that the situation for older people is really tricky. I think there's a lot of invisible need there, and there's perhaps a perception for some older people of that kind of pride of not wanting to access help, not for some people not knowing where it is. There are real issues around the difference between what's available in urban and rural settings. So in urban settings, and particularly where you might have a slightly higher incidence of poverty or deprivation, then you often see services focused there and they're easier to find. If you're out in a rural area where you are one of a couple of households in a relatively prosperous village, getting help for these kind of things is really difficult, because on top of that then you've got issues around public transport and so forth. So I think there are lots of barriers to people being able to access this support, which is why doing things in a joined up way, having networks look, I mean, we're a member of the Feeding Britain network, and we draw a lot from Sustain as well, in terms of how we work, but learning from other areas and joining up and seeing how other people are tackling those issues is really, really crucial. But yeah, there are many barriers. I'm happy to expand on that in a kind of a conversation outside of here, if anyone wants to contact me. But yeah, it's myriad, really.
Thank you very much. I'm aware that I'm kind of asking questions, so if anybody wants to chip in and ask anything, then please put those questions in the chat. But just sort of skipping back to ideas of food overproduction, and in my kind of relatively limited understanding of the subject matter, I know that supermarkets play into this rather a lot, due to what they're willing to stock on their shelves. How do you think that this plays in? What effect do supermarkets have, and has there been any efforts to try and minimise this effect?
It is quite difficult. There has been the move to wonky veg. That was a step in the right direction. It doesn't solve the problem, but it does start to challenge that idea that the food that we have needs to look perfect. It's easier, I think, to do that with food like parsnips and potatoes and things, because they're not branded. But when you look at the amount of food, most of the food that's coming through the system that is surplus, so the sorts of things that are redistributed at the level of organisations like Fair are things that might be promotions that are now out of date. The food's in date, but the promotion's gone. So you've got, I don't know. So now there'll be loads of food that's being put out, product that's being put out around the football. Once this tournament is over, that food will still be in date, completely edible, but you won't be able to put that on a supermarket shelf because now that's gone over. Things that are labelled, they might not even be labelled wrong, they might just be upside down. Right? But they can't be put out on a supermarket shelf. So I would like to see more of that wonky food being available in usual mainstream places, and not creating another avenue, not creating separate, almost second-class supermarkets for people to access that. But to be able to access that in the mainstream. But there are issues around the credibility of branding, and that's one of the main challenges, I think, that branded goods don't want their wonky stuff to be out there, because that impacts on their credibility, I think. There is that overproduction. The overproduction means that you can end up with perfect looking food, because any of you who grow your own fruit and veg at home will know virtually nothing comes out of the ground or comes off a tree looking like it does in a supermarket. Most food doesn't look like that. So although some of that can then be used for for processing, chopping up and cooking, and for processed food. Yeah, that's part of the issue, is us getting used to the idea that food, everything, and the packaging and everything is perfect and timely. Yeah, that's a trick. I'm not sure. I think I've rambled again. Oh, I can't hear you now, Catherine.
I'm sorry. Thank you. That was fantastic. That was some really good insights and things that I'd certainly not thought of before. Michelle is asking, well, pointing out that free school meal income, or in order to qualify for free school meals, parents have to have an income of below 7,400 pounds a year, which, you know, in the UK to live on may sound like a lot, but in the UK it doesn't buy very much.
It's not. So that's earned income. You will be in receipt of benefits on top of that, but that's the level, yeah, for earned income, and it's not a lot at all. So you imagine somebody who has an earned income of £8,000 a year is still not a lot, but they won't meet that threshold, and yeah, that's really difficult.
It is quite shocking, really, when you kind of look at it like that in the context of how much the cost of living is in the UK.
Yes.
Michelle is kind of wondering whether there's any help available at a local level, anything that you're aware of.
Yeah, so we're very lucky in Bath and North East Somerset. We're really lucky because we do still have a welfare support team and a welfare support budget, and that has been largely extended because of COVID recovery funds. So yeah, we are very fortunate that still exists. All local authorities have an obligation, have a duty to support people who are in financial difficulty, but not all local authorities still have a welfare support system that sits within the council structure. Many have they've been outsourced to Citizens Advice or other organisations. But yeah, we're very fortunate in Baines that we can do that, and we can direct people to that additional support. There are lots of other things that help that, but we probably don't have time now to go into that detail. But again, I'm happy to answer those questions if people want to email me after this presentation.
Thank you very much. There is one, I would say last but not least. I'm just going to check because I think there's another question that's come in.
Thank you for navigating this, Catherine. I know how difficult it is to keep track of what's coming up in chats and Q&As and things.
You are welcome, and especially with the sort of COVID times that we live in, then I am slowly getting used to this. So Siobhan is saying that supermarkets, contemporary marketing, promotion, all the things that you were just talking about will always be wasteful, but supermarkets are where most people do shop for food. Very, very good point. And are powerful players in the food system. Do you think that they can be made more sustainable, or do you think that there's anything that can be done in order to get them to consider sustainability and regenerative food supply?
Yes, I think there is, and mainly that. So the problem is the solution, as we say in permaculture. So the problem of most people shopping in supermarkets means that there are a huge weight of customer demand going to supermarkets, which means that if we voice that together as customers, then we can say we want our shopping to be different, we want our food to be different, and we know how big a player you are in this game, and we would like you to behave differently. So things like plastic packaging and that shift, that is being driven largely by people saying to supermarkets, I don't want this plastic packaging, and leaving it behind on the till, you know what I mean? So I think that as a customer base, we can push that forward. I think supermarkets, they're in business, they're savvy, they're not foolish people. They know the direction that things are moving in, and that it's not good business to be behaving contrary to that move. So yes, I do think things can improve. However, COVID consolidated their monopoly on the food market, because everyone was getting deliveries. Lots of smaller food retail places were closing down, or they weren't open. So they have an even larger proportion of the market share now, and I think that does need to be challenged. with with local production, local procurement, community supported agriculture, with whatever it might be. Again, I will keep banging on about permaculture. Diversity is crucial. Monopoly doesn't work. Monoculture doesn't work. You need diversity in a system, and so enormous diversity, and really challenging that monopoly, I think, is important. Supermarkets aren't going to go away, and I think they can do much better than they are, but they also need the vision, I think, should be that they're one player in a diverse food retail system, a much more diverse system than we have now.
Excellent. Thank
if
you
I was
very
Prime
much.
Minister, that's what I'd say.
Very good mandate to run on. So Elias, I'm kind of aware that I may be placing you on the spot a little bit with this question,
Okay.
but it's quite interesting to look at it from a sort of more generic viewpoint. Elias is from Ghana, and he's asking, how can we ensure food securities in local homes, I assume meaning local communities. So I don't know, is there any lessons that you've taken from what you've done that could help to inspire sort of other communities outside of the UK, perhaps in developing economies, in ensuring food security in communities?
Wow, that is huge, and I'm not sure that I can answer that question for Ghana, but I do. Yeah, I think it's fundamentally all we can do is the best we can with what we have in front of us. So we are working in the UK with an established retail system. We have got a benefit system here. So we have to do the best we can with what we have, and then identify the things that are missing and really lobby hard for them. And I guess that's the same kind of basic principle everywhere. It's just that we'll have different things to work with. I do think that what I was saying earlier around trade agreements that don't let countries export anything but raw product, I think that fundamentally has to change, because that impacts phenomenally on economies of other countries in the world, and it's really restrictive. It's they should be able to add value to the food that they're producing and exporting around the world. So yeah, that's the bottom line is you do the best with what you can now, and be really creative about exploring what it is that you have around you, and work with other people. Just join up, integrate diversity, all of that kind of stuff. Just keep talking to people and join things up as far as possible, I think.
Thank you, that's fantastic. First class answer. So thank you for joining us today, Millie. That was a really insightful presentation, and I've definitely learnt a lot, and I have a feeling from the comments that we're getting from our audience that they may have as well.
Thank you.
So just to let our audience know, well, thank you for coming, first of all, and just to let you know that we will be making we've recorded the session, we will be making the recording available, as well as any links that have come up during our conversation today to information. And if you wish to contact Millie, then you can either get in touch with myself, or I think we can share your email address to the participants of this webinar. So just keep an eye out for the email that we'll be sending out with follow-up information. And we look forward to welcoming you very soon for another webinar or another event. Or you can check out the working group on food poverty as well and get involved in the discussion there. Thank you very much, Millie.
Thanks very much, everyone, for your time.
Goodbye.
Thank you.